been a lot of research done, and the research that's been done shows that people benefit if they have atrial fibrillation and they have a lot of risk factors for stroke. They benefit from being on anticoagulants or blood thinners. A lot of people that would benefit from treatments to prevent stroke are not receiving them. And some of them is because the patients don't want that, and that's okay. Patients, it always comes first. The patient comes first. What they want comes first. But we want to make sure that every patient that makes a decision about atrial fibrillation and their treatment strategy has the full evidence, has a really clear, complete discussion with their healthcare provider to understand the benefits and the risks of any given treatment strategy for that particular patient. Part of the piece is patients have to be educated about their condition, whether it's heart failure, whether it's atrial fibrillation, whether it's stroke. They need to understand what are different potential options and what are the questions they should be asking their healthcare provider. So there's the patient piece. In terms of the clinician piece, the American Heart Association has been at the forefront of coming up with recommendations for what is evidence-based medicine and where there are research gaps. So for the clinician, I would say whenever you have a question, what's the current philosophy? What's the current evidence for treating a patient with a given condition, whether it's a cardiologist or a general practitioner or a nurse practitioner? They need to know what the guidelines say, and you can Google American Heart Association scientific statements, boom, you'll get to a scientific statement that will tell you evidence-based treatment for atrial fibrillation. And so far, the most important performance measure is, are patients with atrial fibrillation who have an increased risk of stroke, and we have an algorithm to figure out that risk, are they on anticoagulation? If they are not on anticoagulation, has the provider documented why not? Not every solution works for every patient, but we need to be very careful about thinking through the implications of treating and the implications of not treating or withholding treatment. It's not enough to be free from cardiovascular disease and its ravages. We're really emphasizing healthy living and living longer in optimal or good states of health.